Welcome to the East Meets West podcast on health and medicine. I'm your host, Dr. David Cherian. I am an acupuncturist practicing Chinese medicine, as well as a board certified family medicine physician in Houston, Texas. And this is the podcast where we talk about health and disease from both an Eastern Chinese medicine perspective, as well as a Western allopathic perspective, and how those two unique systems can work together in a complementary way to help patients get the best health and the best possible outcomes for their condition. So every episode we talk about a different condition, and I thought today we'll talk about a condition called overactive bladder. Overactive bladder, what that is, what it means, how it affects you, how to treat it, and then most importantly, what can acupuncture and Chinese medicine offer you if this is a problem you suffer from? So the first question is, what is overactive bladder? And to help clarify the terminology, another name for it is urinary urgency incontinence. That's another name that you might see, although more commonly we just call it overactive bladder. And mainly they're talking about the same thing. And in today's podcast, we're going to be talking about overactive bladder specifically in relation to women, how the symptoms present and how it is treated from a Western medical standpoint. It can be slightly different for men versus women, but we are going to focus more on how it affects women today. And when it comes to the Chinese medicine perspective, we're going to be talking about the differences and how it's a lot more individualized approach. So overactive bladder is when a woman has a sensation or feeling like needing to go to the bathroom and urinate very quickly. It comes on very quickly. You feel usually at normal baseline, you have a kind of gradual sensation in your bladder that it's getting more full, and you have warning time to go find a restroom and go urinate, and it happens over a little bit slower progress. But with overactive bladder, that sensation comes on very rapidly. For some people, it may come on within a few seconds, and when it happens, it can cause a woman to accidentally leak urine out. And this leakage, it might be just a few drops, but it might be up to emptying your complete bladder and soaking your clothes with urine. So it can be very uncomfortable. It can be very embarrassing. It can be very difficult for people who suffer from overactive bladder to be able to go out in public or go to the stores, do the things they usually do, because you're worried about whether you're going to be accidentally leaking out urine, whether you're going to have an accident. So it is a very frustrating disease for people who are affected with it. And in addition to the symptoms I said, there's also other symptoms you can have. You can have nocturia, where you have to wake up at night to go urinate. You might feel like you need to urinate frequently throughout the day. A lot of times people who have overactive bladder, they may go urinate, and then within 15 minutes or 20 minutes, they have a feeling like they need to urinate again. So urinary frequency is another commonly seen symptom of overactive bladder. So how do doctors diagnose overactive bladder? Well, we know overactive bladder tends to be more common in older women, and it's thought that the symptoms happen because of overactivity or a hyperactive muscle in the bladder, and that muscle is called a detrusor muscle. Detrusor muscle. And you may not realize it, but our bladders have muscle tissue. A lot of times we think about muscle being in your arms or in your legs, but it's not just in your outer skeletal system. It's in different organs as well. And one of them is the bladder, and there's muscle tissue in the bladder. And there's a specific muscle called the detrusor muscle, and that muscle is found in the wall of the bladder. And the detrusor muscle is the muscle that helps to relax the bladder, which allows it to fill up and store the urine and contain it. And then it's also the muscle that contracts and squeezes out and releases all that urine. So it's responsible for contracting and then releasing the urine. And it's also the muscle in the bladder that prevents the urine from flowing back upwards into the kidneys. So it's an important muscle, and it's crucial that it's functioning normally to have normal, good urination. And when this muscle has problems, that's when you tend to have overactive bladder. So there are some medical conditions that can make a woman predisposed to having problems with the detrusor muscle. So, for example, if you've ever had any neurologic problems, strokes, or spinal cord injuries, any bladder abnormalities, having had urinary infections frequently, those can all be things that affect the health and strength of your bladder muscle, the detrusor muscle, and affect that control that your body has over it. So when it comes to diagnosing overactive bladder, the main thing is really the symptoms that you're having. So a lot of times when you go see your doctor, the main thing that they want to know is just what type of symptoms you're having. There are a few different types of incontinence, and the way the doctors usually distinguish them is by asking questions. So there's not one specific test that's done. It's mainly diagnosed by history taking, by asking questions, and then by examining. Usually, a doctor will want to check at least a urine sample. They'll want to check a urinalysis, maybe send it for cultures, make sure there's no urinary tract infection going on, because urinary tract infections can cause a lot of similar symptoms as overactive bladder. But beyond that, there's not a lot of stuff. Sometimes your doctor may want to do additional testing. There is urodynamic testing, and they usually will want to do it more if it's getting to the point where they're considering surgery, or they're concerned you're retaining urine or something else is going on. And then in that scenario, they might recommend it, but it's not typically done for just everyday urinary overactive bladder. So it just really depends on your particular situation. And so that's something you want to talk to your doctor individually about and see if there is anything specific that they recommend in terms of testing for you. So let's talk a little bit about the treatment options, and we'll start first from a Western perspective. Treatment for overactive bladder is similar to other types of incontinence. And in terms of similarity, they're similar in that the first line thing that we usually recommend for overactive bladder is exercises. And if you remember when we talked earlier, we were talking about how overactive bladder is a result of the detrusor muscle acting inappropriately, contracting and spasming when it's not supposed to. And so it makes sense that doing exercises to help retrain the muscle, help strengthen that muscle, help improve your neurologic control over that bladder muscle will improve your symptoms. It makes sense, right? So there are a variety of different techniques that you can do to improve muscle strength, and these exercises are broadly called pelvic floor muscle exercises, or commonly known as Kegel exercises. Okay, Kegel exercises or pelvic floor muscle exercises. And the name kind of describes it. Pelvic floor muscle exercises means it's helping strengthen the muscles that make up the base or the floor of the pelvis. Okay, so pelvic floor muscle exercises, Kegel exercises. What these exercises are is basically where you squeeze and tighten the lower pelvic muscles, and you squeeze it and hold it Usually you want to hold it for at least 10 seconds when you're starting off, and then over time you can build up. But you squeeze, you hold, and then and then after that time is done, you then relax the muscles. And it can be a little challenging to learn because you need to learn how to squeeze and contract and hold the exact correct muscles to really get the benefit out of it. So one of the things that people say as a tip is that if you're trying to do these exercises, imagine that you're sitting on the ground and you're sitting on a small marble and you're trying to use the muscles underneath you that you're sitting on to lift that marble. You're trying to squeeze the muscles at the bottom of the pelvis to lift the muscle, to lift the marble. And it is something that you need to take some practice. You might want to watch some videos on how to do it or watch some teachers on how to do it. A physical therapist who is specially trained in that, or a nurse specially trained in that, who does a lot of work in that field, may be able to also help you learn how to do those the right way. But Kegel exercises are a core aspect of treating overactive bladder in Western medicine. And so that's something that you definitely want to do. Usually we recommend doing about 10 of those exercises, 10 of those, doing that exercise 10 times for a single session, and then do that about 3 times a day. And you want to do this for several months, at least 4 to 6 months, because what you're really doing is strengthening the muscles, retraining your brain and your ability to control that. And so it's something that takes several months to build up and to notice that difference. So that's a little bit about exercise, but there's a few other things that I wanted to talk about from a treatment standpoint in Western medicine. Ideally, the exercises will be able to help, and for a lot of people, that might fully treat and control your symptoms, and you won't need to do anything else. But in a lot of cases, that may not be enough, and you might still have symptoms, and you might still have urinary leakage or incontinence. And so if you're in that group of people, then you want to consider medications. And there are two large classes of medications for overactive bladder, and we'll talk about each one of them. The first class, the official technical name for them is beta-3 adrenergic agonist medications. And it's a long name, but these medications work by helping to relax the muscles by binding to receptors that control that muscle in the bladder, and they control muscle relaxation. So when you take the medicines, they help to relax the bladder wall muscles. Some of the side effects of these medications, you can get a headache, nausea, diarrhea, constipation, runny nose. Some of those types of medicines can increase your blood pressure as well. One of the most well-known medications in that class is Myrbetriq or Mirabegron. The trade name is Myrbetriq. And that class of medications are preferred usually, but they can be a lot more expensive. So not necessarily something that you may be able to get. It might be out of your network in terms of your insurance, or it might be too expensive. They are a little bit newer class of medications, so that's why it's not as easily available as the class that I'm going to talk about next. And the next class of medications is what we call muscarinic antagonists. And muscarinic antagonists they tend to be a little more commonly used for overactive bladder. And probably the biggest reason is because they're just covered by more insurance companies. They're a little bit cheaper, and so we see those used a little bit more. One of the ones that I commonly see a lot of patients using is a medicine called oxybutynin, and that's a common one. Pretty much all the medications in this class are going to have side effects of dry mouth. They're going to maybe cause some constipation, some drowsiness, and there is some concern that they may also be associated with dementia. It's not really clear whether the medications cause it or whether patients who have dementia just also more frequently happen to have overactive bladder and need to be on these medications. So that's something that we don't definitively know, but there is a little bit of concern with that association. So sometimes people try to avoid those and use the other medications like Myrbetriq or Mirabegron that I was mentioning. But it all depends on kind of what your particular situation is, and that's something that you want to talk with your doctor about individually to find what the best fit is for your situation. So we talked about exercises, we talked about medication options. The last thing I'm going to talk about from the Western side is some of the surgical options and some of the more invasive options. And there's numerous different therapeutic options in this broad category of interventional options. And we'll touch briefly on these, but I'm not going to go into too much detail. Number one, because they're just not as commonly used. Number two, because you're going to need to talk to a specialist to get to those and really consider that. And number three, I think if you're getting to that point where you're considering that, you should, in my opinion, you should definitely be considering and using and trying acupuncture and Chinese herbal medicine as well at that point. And so, so knowing all of that, there are some options when it comes to interventional options. One of those are tibial nerve stimulators, and a tibial nerve stimulator is actually somewhat similar in terms of principles to acupuncture. It uses a needle that is inserted behind the ankle, and then you apply mild electrical stimulation to it. And that is, I think, very similar to some of the principles that we see in acupuncture. Another treatment option is Botox injections. Okay, a lot of people think that Botox is just for cosmetic reasons or to treat wrinkles, but actually Botox does have a lot of other uses, and one of them is for overactive bladder. It can be injected into the bladder detrusor muscle, where it helps to relax the bladder, and it can last for several months once you get an injection and help improve urinary control. So that is another option. You do have to be cautious if you have Botox injections. There is some concern that they may cause higher rates of urinary tract infection. So that's something you have to watch out for. And then the last thing, there are surgically placed neurostimulators. And these tend to be more severe cases. You have to actually go in, surgically implant a device. And then these neurostimulators, they provide nerve stimulation to the bladder to help control and improve bladder control. So those are things you want to talk about with your doctor. You're going to be seeing a urologist at that point for most of these advanced options. And it's really outside of our scope here. But I do think if you're up to that point, you should be considering Chinese medicine, considering acupuncture and herbal medicine. And that being said, let's go now to talk about Chinese medicine and herbal medicine and how it's viewed from a Eastern perspective. So I wanted to just briefly bring up this article that was recently published. It was published in March of this year, 2023. And the title of this article is Acupuncture for Women with Overactive Bladder, Perspective of Traditional Chinese Medicine and Related Mechanism. And this article was published in the International Journal of General Medicine. And it was published by researchers in China. And what these researchers looked at was clinical trials that were available in the databases going up to 2022. And what they found was that a majority of the studies reviewed showed that acupuncture was safe and patients tolerated well and it improved symptoms for a patient. And the focus of their study was on which points were commonly used in the treatment of overactive bladder in these various studies and what the researchers were considering. So several of the points that were commonly used were points that were actually located on the bladder channels. And so, like I said earlier, when I was talking about posterior tibial nerve stimulation, that's actually the area they inserted on is an area that is part of the bladder channel in Chinese medicine. And so it makes sense that those things are connected. And so they used points on the bladder meridian. They did use points on the Ren meridian, which is it's the meridian that goes up the midline of the frontal central portion of your body. And several of these points were actually located in close proximity to the physical bladder on the body. And they also did use distal points. The researchers postulated that acupuncture may release excessive local qi in the bladder. It may work by inhibiting C fibers and reducing spontaneous contraction of the bladder muscle. Interestingly, they did recommend that they recommended points on the bladder, on the Ren meridian. They actually also found a point on the spleen that was commonly used, and that point is spleen 4, which is located on the inner part of your foot, as well as kidney 3, which is also located on the inner part of your ankle. So that was some interesting findings that they had. The researchers recommended doing acupuncture treatment for no less than 4 weeks, at least once a week, and having each session last at least 20 minutes. So those are some of their baseline conclusions that they found from looking at these different studies. And so the study they did, it showed promise and benefit, and it showed benefit from the points that they were analyzing. And one of the important things that I always want my patients to understand is that the treatment will vary from patient to patient. Even though the research articles may say this is a commonly used point, this is a commonly used point, that is true, but we always have to take each individual patient into account and what's going on in your body and why you might be having an overactive bladder uniquely in your situation. And so there are common situations, definitely, but it also has to be an individualized approach. In my experience, just common things that we see in our clinic for overactive bladder, we definitely see a lot of issues stemming from weakness in the spleen from a Chinese medicine perspective. The spleen is an organ that is crucial and central in processing water in the body. It connects with the bladder, and when you have weakness in the spleen, it can impair proper metabolism of water and cause overactive bladder. Another organ that we commonly see in the clinic is the lung, and the lung is also responsible for controlling the qi of the body. It's crucial for controlling the water in the upper part of the body, and that also affects the strength of the kidneys and the bladder and your ability to control urine. And then finally, probably the most common is kidney. The kidney is an organ which is directly related to the bladder in Chinese medicine. They work very hand in hand, and kidney problems will usually be, to some degree, an underlying part of the treatment for overactive bladder. So those are some of the commonly seen organ conditions. Now, there are much more, and it varies significantly, but in a broad categorical sense. Now, in our clinic, herbal treatment is a mainstay of the treatment plan for our patients when it comes to treating overactive bladder. We use acupuncture and we use herbal medicine, and they both work hand in hand, and together they're what gives us the best outcomes. So we recommend being on herbal treatments in addition to our acupuncture protocols. So in conclusion, overactive bladder, it's a problem that affects many people. It's very debilitating. It can constrain your daily life. It can affect you negatively, keep you from doing things you want to do, keep you from enjoying the things that you want to enjoy, and interacting with people. It can be very detrimental to your personal life. And so it's a difficult disease. It's a difficult disease. And the good news is there are treatment options, both in a Western medicine and especially from a Chinese medicine perspective. And if overactive bladder is something that is affecting you, we recommend you take a closer look at acupuncture and Chinese medicine. If you'd like to learn more about how we can help you, we recommend checking out our website, www.houstonacupuncture.com. That's www.houstonacupuncture.com. You can get to see our services and familiarize yourself with what we do. But again, if you are suffering from overactive bladder, definitely consider what Chinese medicine may be able to help you with, especially if you're getting to the point where you're needing to consider invasive options. I definitely would. So it's good talking to you guys today. Good speaking with you all, and we'll see you next time here on the East Meets West podcast. Bye-bye.